This report examines the 17 most prevalent cancers and looked at studies that included over 51 million individuals, and we were able to assess 1.7 million cancers through those studies. So this is by far the most powerful assessment of the relationship between food, nutrition, exercise, and cancer that's ever been done. Cancer is complex, and we appreciate that. There are hundreds of different types of cancer, and the risks are multifactorial. But when you take cancer as a whole, as a public health problem globally, somewhere around a third of the cancers are related to tobacco. We know this, and it will account for nearly 1 billion deaths in this century. Now, when you look at the next category, food, nutrition, obesity, fitness, exercise, and you pool all that information, it likely will account for another 1/3 of all cancers. Now, even then, it isn't that it's just the food alone. It's interactions with genetics, interactions with other exposures. But food and nutrition, fitness, exercise is likely to contribute to at least 1/3 of all cancers. I don't think there's enough effort in the cancer prevention realm, and I agree that we probably devote 95% of our resources in the cancer control realm to therapy. Now, the cancer diagnosis is a frightening moment, and there's so much uncertainty associated with that for individuals. Gosh, physicians who care for patients know the multitude of pathways that can develop after a diagnosis in treatment. And there is this pressure and this feeling of urgency when you're coping with lethal diseases to bring something new to the table that's going to give an individual a longer remission or a cure. We all know that. And we shouldn't take away from cancer therapy and the efforts to focus on new advances there just for prevention. We need to be doing both, and we need to be investing in both equally. And I think prevention is a longer-term strategy, because you're really talking about bringing those prevention strategies in at a younger age and instituting them over many, many years or decades to get a good outcome. But there's no doubt that it's far better to never have developed a cancer than have to fight the battle after diagnosis. So I fully endorse our continued efforts for therapy. We're making great advances all the time. But another part of me says we really need to invest far more greatly in the prevention side. It's a challenge that we have overall in educating our society through public health messaging that is in many ways consistent. Whether we're talking about a cardiovascular outcome, diabetes, renal disease, and cancer, many of the foundational findings are very similar. And this gets back to public health guidelines and recommendations that are translated by governments into public policy. This is one of the areas that we truly need to work towards, is to seeing more of this information provided through education, through messaging at doctors' offices, maybe through our insurers, through our workplace. But we do need to do a much better job in terms of educating our population with regards to what they can do, how they can be empowered to look forward and have healthy aging throughout the life cycle. I think the future is going to see continued effort in the research And I think as we more precisely can assess what people eat, and even more precisely the combination effects or the patterns that impact cancer risk, we will come up with even better guidelines for prevention. And another aspect that's going to be coming into this is more and more we're identifying individuals earlier in life that may be at risk for a subsequent cancer through family histories, genetics and inheritance, prior exposures to cancer-causing events, whether it be at the workplace or in the environment, those with pre-malignant lesions, early skin cancers, polyps, and other things. We are identifying populations that are now at risk, but yet are more interested in prevention strategies. So they're motivated, they're teachable, and they want to do something to prevent that cancer from ever developing. So more and more we're going to develop more carefully tailored or precise interventions for those at risk. And this is a wonderful opportunity to do new clinical trials, invest some of our research dollars in that effort to show how we can truly prevent cancers in these high-risk populations.